Why is overflow incontinence misdiagnosed? Bladder health. Imagine trying to solve a puzzle where some pieces are hidden or look similar to others. That's often what happens with overflow incontinence. It can be tricky to identify because its symptoms can look like other bladder issues. Many times, doctors might think it's urge or stress incontinence because urine leakage can happen in similar ways. But with overflow incontinence, the main problem is that the bladder isn't emptying fully, leading to constant dribbling or leakage. This subtlety can be missed if the symptoms aren't carefully evaluated. One reason for misdiagnosis is that the signs of overflow incontinence are not always obvious. Some people don't feel the urge to urinate or notice they are retaining urine. This can happen if nerves that sense bladder fullness are damaged, which is common in conditions like diabetes or nerve injuries. Without the sensation of a full bladder, patients might not realize they have a problem until leakage occurs. Because the symptoms can overlap with other types of incontinence, it's easy to confuse overflow incontinence with urge or stress incontinence without proper testing. Another challenge is that diagnosing overflow incontinence requires specific tests. A healthcare provider needs to measure how much urine remains in the bladder after voiding, often called a post-void residual measurement. Sometimes, urodynamic studies are needed to see how well the bladder and urethra are functioning. If these tests aren't done, the true cause of leakage might be missed or mistaken for another condition. This is especially true if the doctor relies only on the patient's history or physical exam, which might not reveal the full picture. Medications and other health issues can also complicate diagnosis. For example, some drugs used for other health problems can reduce bladder muscle activity or hide symptoms. Conditions like prostate enlargement in men or pelvic organ prolapse in women can cause urinary obstruction, making it seem like a different issue altogether. If these factors aren't considered, the diagnosis can be incorrect. It's also important to recognize that both patients and healthcare providers might not be fully aware of overflow incontinence. Patients may feel embarrassed or may not understand their symptoms clearly. Healthcare providers, especially those less experienced with bladder conditions, might not think to check for urinary retention or perform the necessary tests. Because overflow incontinence is less common, making up about 5% of chronic urinary incontinence cases, it can be overlooked or misclassified. Misdiagnosing overflow incontinence can have serious consequences. If it's not correctly identified, treatment might be delayed, leading to infections, bladder damage, or even kidney problems. In cases where symptoms resemble those caused by bladder tumors or obstructions, a proper diagnosis is vital to rule out more serious issues. Accurate diagnosis involves a careful review of symptoms, physical examination, and appropriate testing. Recognizing the subtle signs and understanding the underlying causes helps ensure patients receive the right treatment and improve their bladder health. Always consult a healthcare professional for a thorough evaluation if you experience urinary leakage or retention issues.